Joan said you can start streaming now. Okay. Okay. You know if that's the speaker? The black thing?
That looks like, wow, yeah, that looks like a Bose speaker.
Do you know how are they going to speak into a mic for the press conference?
I have no idea.
Do you know if they're gonna speak into a mic for the press conference?
They're actually going to do a press conference. Yeah, they're going to do the press conference. They will have one in English.
One person said the doctor is outside talking right now. He's going to be one of the speakers, so they're waiting for him to finish. Come on.
A little bit of sacrifice for speaker cost. So we'll have. Are you getting to when we're starting?
Good afternoon, everyone. I want to welcome each and every one of you to the press conference this afternoon. Especially would like to welcome the news media. Thank you so much for coming out. I'd also like to thank the Honorable Speaker, Honorable Senators, for this opportunity to dialogue honestly about the best way to provide high-quality health care to the people of our island home. I want you to think back 20 years ago. What was Guam like as far as its health care? Was Guam's first birthing center here, Sagwa? No. Was Guam Medical Plaza here? No. How about the Guam Surgery Center? Guam Cancer Care? Guam Radiology Consultants? Answer is no. How about MDX? How about GRMC? American Medical Center? Dr. Cunha's Wound Care Clinic? All no. How about Dr. Shea's Clinic for Women? Dr. Yang's Clinic for Dermatology? Dr. Castro's Clinic for ENT? How about the hemodialysis centers on island? None of them were here. There was no sleep medicine center on island. Dr. Lombard's clinic, not here. Dr. D. Benedictus Clinic, not here. The new hospital, GRMC, wasn't here. Many other private medical clinics and practitioners were not here. Remember, 30 years ago, the surgeons were writing in the PDN that it was not safe to do surgeries at GMH. They were advising patients to go off island. Times have changed. They can do surgeries here safely in our island's hospitals. It's because we work together. As one team Guam, the Guam legislature, dedicated healthcare providers, the governor, dentists, nurses, pharmacists, respiratory therapists, the people of Guam have all worked together to make Guam a better place. We have come a long ways. We have a long ways still to go. Let's keep going. Keep on doing the best for the people of Guam. Now I'd like to turn the time over to give a couple of presenters a couple of minutes just to share their thoughts. I want to invite Dr. Jolene Agan up.
I'm just going to keep this very short. I am Jolene Uggan. I'm a pulmonary and critical care physician, Hagan Guahan, and I oppose 236. Dr. Maniloto?
He's in the hearing yet.
Dr. Nguyen?
Dr. Wynn.
Wow, I see a lot of people here. So thank you for all our provider and clinic and everyone to be here. You know, we really, just like Dr. Mike Robinson said, we come a long way since I'm here, and I was here since 1995. Bill 112, it's going to step us back like 30 years. And you know, we are As you can see, in the past few months, we have a lot of shortage of specialists, and we all here really to try to improve the quality of care for the people of Guam. I know the senator have some good heart and try to improve the healthcare of Guam, but I think that we should all sit down together and talk more before we propose just a bill like 112 that can set us back many, many years. It will really impact on the access of care for the people here in Guam. And I really ask the community to talk to the senator and our governor and try to not let this thing pass. Because if it does, again, we will step back many, many years that a lot of us here try to improve the quality of care in Guam. So again, I really, on behalf of the American Medical Center and the Tier 2 clinic, which do a whole lot for the during the pandemic, along with Guam, GMH, and GRMC, and public health, we really ask you to kind of work with the provider and the clinic and really improve the quality of care for Guam. Okay, thank you.
Buenas and half a day. Thank you, brothers in healthcare, and of course everyone involved in caring for our patients, right? Much has been said about this bill, right? But at the end of the day, this bill should be examined from the lens of not just the doctors. It's the patients, right? If there are other, we can consider in terms of options, right? The community has said, and the medical community has said that we're willing to pay for this. There are options for us to be able to provide access. That's the core crux of the argument, right? To be able to provide access not just to a few, but to everybody, right? Creating a fund, a fiduciary fund that would provide access to all members of the community to be able to access the MMA, but to leave it in place, right? Why is that? Because we're asserting that the fact is that these claims cannot be competently adjudicated or decided upon. These are complex medical issues that have to be not only, we have anyone who's sat on a M&M panel or any of this, you guys know how difficult it is. Even as doctors, there are subtleties to all of this. And that's the reason why we say keep the MMA in place. There are other options. Let's fund it. Let's ensure that there's access to every Guam resident, right? And I think that's a commitment the medical community is willing to make. That's one, right? Number two, let's strengthen and create a better environment for healthcare, for quality care on island. How do we go about doing that? Having more doctors, having more clinics, having more specialists, enticing them to the island. How do we go about doing that? Having the Governor Guam Claims Act applicable to not only the government but also the private sector, so that we're actually able to get malpractice insurance on island, right? So that we're actually able to price these things, so that we're actually able to control these costs, so that we can continue to operate and give great care to the community. And I thank everyone for being here today and standing in unison with us, because honestly, there are better alternatives to this, right? There are less divisive alternatives to this. We can choose something else, right? There are other solutions out there. Okay? Thank you.
Thank you so much. I want to invite up Dr. Berg. Dr. Berg's inside. There he is. Okay.
Thank you, Michael. I will keep it brief, which is always a challenge for me, if anybody knows me. but I will keep it brief. I think the point was made that there are alternatives. And also, if we look at what the speaker is trying to do, I applaud it. What is she trying to do? Make the access to the arbitration panel affordable for those who can't afford it. There's no one here who wants to have it be not affordable. So we need to sit and talk and say, how do you make it so those who meet certain criteria, you gotta, you'll have a chance. You'll have a chance. Okay, I'm just asking, just be polite, allow us to speak, thanks. So the issue is that if you make a panel where you can judge whether people are eligible for Medicaid, you can make a panel that says whether you can afford to have the fees for arbitration. No one's here is going to oppose that if someone can't afford arbitration and can't find someone to take it on contingency, a case of contingency, that they be afforded the ability to go to an MMA. MMA is a doctor of our choice, a doctor of the other person's choice that you agree upon, and an attorney. So if we find a way to MMA to participate in it, we're done. What you don't want to do is then get rid of it, because as everyone else has pointed out, and I'm not going to go over again, it's been critical to Guam getting better and better health care. And getting rid of it is going to, as Dr. Hua mentioned, going to set us back years. We're not going to have more access to critical care that is needed. Prenatal care perhaps is the one that's going to be affected immediately. We're already super short. And that's not Dr. Berger, the other doctors telling you we're short. The Health and Human Services that makes that assessment says we are one of the few places in the country that is short of every single specialty. We want to fix that. We want to bring people out. We're trying. And we have been over the last 30 years, right? So we want to keep things going. We want to help her to fix the one problem that really exists. But don't tear down what has worked to build up Guam's healthcare community. Just work with us to help fix the problem that we all agree exists. And that's it.
Thank you, Dr. Berger. Really appreciate that. Thank you so much. I'm going to invite Dr. Mariana Cook to come up now. There we go.
Hafade. My name is Mariana Cook-Wen. I'm local to Guam, and I'm here representing the women health providers on island. I am a family medicine obstetrician, and I practice alongside a very limited amount of OB providers on island. This bill 1112, while its intent is good for the community, it is not the way to manage what the underlying issue is. Affordability can be taken care of by some of the ideas that have been proposed already through fiduciary funds and more access to financial compensation for people who cannot afford to go through the Arbitration Act. But the Arbitration Act is going to decrease cost ultimately, because litigation is also very, very expensive. In the OB practice, we have one of the highest malpractice claims against us, because there are bad outcomes that happen, not often because of medical negligence. And that is a very difficult thing to understand unless you have the medical expertise and the medical experience and you live this life every single day. We are down to 3 private clinics that provide OB care, and the burden is left on the hospital and on public health. We have multiple women out there in the community who cannot find a prenatal provider as of now. If you take 1112 into account, that number will drop even more, and there will be more women harmed, but more importantly, more babies harmed, more babies dying. We already have one of the highest national averages of infant mortality on this island, and that is where we are right now. This bill is going to have a ripple effect. There are so many things down the road that it is going to cause. People do not want to come to Guam for multiple reasons. Those of us who are from here or who have come here and decide to stay here, we are the ones who are going to be holding up the healthcare system. Not only the physicians, but everyone else who supports us. We have multiple times where we cannot find supplies, we cannot find equipment, we cannot find medications on this island. Bill 1112 will make this even worse for us. So I just explained all those ways. So we need to say no to this bill. We need to come to the table. We need to have our senators really listen to us. They have heard from us last summer, and here we are again in unity saying, no, this is still not the solution. We need to come to the table and come up with a better solution for what is already a fragile healthcare system, and it's only going to get worse if this bill were to pass. Thank you everyone for coming out here today. Thank you for the organizers. We will get through this, but we need the support to say no to this bill.
Thank you so much. I want to again welcome or second her thanks to everyone. Thank you so much for coming out. Now, as you know, this is a press conference, and so we invite the media to submit questions to the panelists. You need to show me your press badge in order to do questions. Is there a media person who would like to ask a question? Yes, sir. You have a press badge? Okay. Perfect. Sounds good. Thank you so much. Yeah, thank you. So, who would you like to ask a question to?
It addresses that, but because I was a former CPA in another life before becoming a doctor, right? So the thing that you have to determine when you talk about government funds is the kind of fund that it is, right? So you have your general fund, which basically is responsible for the operations of the government, but at the same time you have what they call fiduciary funds. The retirement fund is an example of a fiduciary fund. So the way that you do it is you ensure that this fund is, number one, it's adequately funded, right? So the way that you're able to do that is how many malpractice or how many MMA cases are there in a year, right? What's the estimated cost of the litigants? You divide that, you fund that, you put that money there. How do you ensure that that fund remains in what they call perpetuity, that it survives? You have annual fees going into that fund, but at the same time, right, you create a mechanism in which if frivolous claims are filed, if they are filed, you know, if a lawyer says, okay, you should file a claim because I think there's money at the end of the rainbow for you, for a patient, right? The way that you can do it is put in penalties in place, not for the patient, for the plaintiff, because the patient is grieving for a reason. It should be their legal counsel, right? If the arbitration panel finds that it is a frivolous claim, they have to reimburse this fund back, the costs, right? So it would be no cost, no upfront cost to the plaintiff, based on a means-tested approach, which means that if you can't afford it, the fund will, or if you can partially afford it, the fund will fund those costs for you. And if at the end of the process, the arbitration process, if they say, hey, guess what, this was a frivolous claim, right? It should not be the patient who's already grieving. It should be their legal counsel who coerced them and said that you should go make this claim, right? And I think that's only fair. But at the same time, and that's why I say that it's a two-way street. If the doctor is found to be grossly negligent as a healthcare provider, I don't want to be paying for another's gross negligence. They should reimburse the fund. I think it should work both ways.
That's right. That's right. Thank you.
Dr. Manloto, can you guys make sure to repeat the question? Well, no one can hear what the question is.
basically, if you look at Bill 112, it provides a cornucopia options, right, in which you can decide to go to arbitration, right, or you can decide to what they call this pre-suing judge, right? But in all of this instance, it does not in any way provide for amicable settlement. Why? Because of Section 10107, right, of the bill that says regardless if you go before a judge, a pre-screening judge says, hey, this is frivolous. Guess what? Regardless of that judgment, their legal counsel can say, hey, guess what? Let's go to trial, right? Let's go to trial. The trial de novo after the arbitration process, right? But the difference is that when you talk about things in terms of why is it that we allow a process to be completely non-binding for now, right? This non-binding process, it's a pre-screening trial, right? What ends up happening is that when you repeat it, right? When you repeat this entire process, where is the justice in that? In the sense that if I go before a pre-screening trial judge and they say this is frivolous, and they decide to go to trial, You could still go to trial, but the difference is that you are in front of somebody who's competent enough to be able to determine the subtle nuances. These medical malpractice claims, right, and cases are not straightforward, right? They're not straightforward. It's not like we can go to a book and say that, hey, this is how you're supposed to practice medicine 5,000 miles out in the Pacific without the resources that you have. Every one of your medical providers was trained what resources are, what we have, right? It's different, and that's what we're saying is that competence, being able to, even as doctors, these cases are complex, and that's why one of my testimony provides that Dr. Berg needs more resources, right? How do you evaluate the claim of another neurosurgeon? I can't do that. I'm an internist. Nor can a radiologist do that. It has to be another neurosurgeon. So they need the resources to be able to investigate these claims. That's what we need to do. We need to strengthen the board, give them the resources that they need so they can properly do their jobs.
Thank you very much. Another media question? Would someone like to take that up? Yeah.
Yeah, this whole thing is start out by, access for the indigenous population for the fund for arbitration. Well, arbitration, any type of legal system is expensive. So I know the legislature, as part of the committee that tried to propose a funding source for the indigenous population in order for them to access it if the case is deemed not frivolous. So basically, the fund comes from the annual fee for itself in general. And then basically, if anyone want to file a claim, they got to go through a panel of judge that to be determined, and they think that the case is not frivolous, then they can fund that for that person if they met the Medicaid or any type of guideline for indigenous population. So the fund is there, and the proposed change in the law was there, but I'm not quite sure where it is. But we as provider, everyone here, want everybody, especially the indigenous population, to be afford to go through the arbitration, process at this point in order to go forward to any type of trial. So the proposed there. That's why we're asking the senator to go back and look at the proposed bill for the funding source. And the funding source, we are willing to fund that. You know, we have an annual fee that we do every year for our medical license, and that's as part of the funding source for the people that cannot afford arbitration. So that's the proposal. And so this they keep the people to have access to the fund, and that way they can protect the people that we try to protect at this point. Like I say, not everyone gonna be happy, but it serves the purpose to improve the quality of care people want and the access to the fund if you can't afford it.
Thank you very much. One more question. Just state what media group you're from.
We don't have the license. And we're going to pay the highest. Staff, everyone kind of tear down, add a certain amount of fund into the renewal process, and that is the base fund for access. And if you if you really have a good case and you go through and you lose the case, you don't have to pay anything back. But if you win the case, then you can return the fee, part of the fee for arbitration into the fund for people to use. It's a simple process to keep the fund alive and let people have access to the fund. Something like I say, we can talk differently in a different way, try to solve this thing, besides going through the 112.
Thank you very much. Due to time constraints, we'll close this. We just want to thank each one of you for coming out, and thank you so much, the media, for attending. Thank you very much.